Recently, we've had a huge uptick in phone calls from new patients who have been completely baffled and frightened by the information that they are reading on Facebook. And last year we had Dr. Naveen Pemmaraju speak with us at one of our events, our educational programs, and he spoke about the issues surrounding social media, the good things and the challenges. And I thought it was important to speak with him again today at ASH to ask him what we can do to filter out some of the poor information or the information that is on Facebook from patients when we're working with such a diverse and heterogeneous group of MPN patients who require lots of different things and should be seeking advice from their physicians. So, Dr. Pemmaraju, thank you for doing this with us
Thanks
today.
for having me here, Ann.
What would your advice be at this point? Because you did such a great job speaking to our patients at our educational program and also our newsletter. So, what would you say to this today?
Ann, thanks for bringing up this important issue. This is becoming one of the key issues for not only patients but all people around the world. How to interact with social media and online sources. I have a couple of tips for folks, and my group and I have published on these as well. The most important thing to find out about information is it's okay to look up information. So I want to emphasize that to our viewers and everyone who comes to you for education and for learning. I do encourage people to still look up things online, but don't do it in isolation. The key is, as a patient or a caregiver, because many of our folks out there are caregivers, is to look for all the information you want to out there, but do it in a way that you can talk about it with your loved one and talk about it with your doctor. Oftentimes our patients tell me, oh, I was afraid to bring this up to you. Don't be. It's your body and it's your life. So if you're looking up information, don't do it in isolation. Bring it with you to the visit. That's part one. Part two is, yes, as with any form of media, whether it's print media, online media, visual media, there's going to be inaccuracies and errors. Even sometimes we as thought leaders, me, Ruben Mesa, all of us, we strive to put accurate information up there, but every once in a while there may be something that doesn't fit or may need to be revised later. That's okay. Information is meant to be revised and looked at later. So if you're doing my technique here of reading everything you can but then discussing it with your family and your doctor, now you have a filter or a way to start to understand what's good and what's bad. And then the last part of it is you'll start to identify trends in your Facebook community, online, on Twitter, which is something I'm active on, hashtag MPNSM for myeloproliferative neoplasm patients, run by us, investigators. Then you start to realize, oh, maybe that source is not exactly what I'm talking about. Or, when people are talking about patients with polycythemia vera, they're not talking about me because I'm on treatment XYZ. And so we have to think about things as general versus specific, patient-centered versus general or broad brushstrokes. So those are kind of some tips that I would give to anyone out there.
Thank you so much.
Thanks,
that was
Ann.
fantastic. And I hope all of you that are listening to this heed this expert advice. Thank you.